Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CVCT of the patient that you had requested. There is no specific area of interest on the pseudo panoramic view. We'll start with the top right. This is the top right second premolar. It's a BDR on the transaxial view. You can very clearly see here. Moving to the upper right first premolar. As you can see right here, this is a grossly carious tooth which will need to be extracted. The ridge width in the region is approximately 10 millimeters and the height is approximately 13 millimeters. In the region of the 5, we've got a ridge width of 11 millimeters and a height of 10 millimeters. This is the upper right 6, the upper right 7. We've got a, as you can very clearly see, we've got a distomolar, it's a supranuclear tooth, distal to the upper right wisdom tooth. Moving to the upper right 3, that seems fine. The upper right 2 has slight bit of thinning right here. And then we move on to the central incisor. Endodontically treated, no periapical radiolucency. Poor endodontic treatment, but no radiolucencies can be observed. This is the central incisor on the top right side. Moving to the top left first premolar, again a BDR, ridge width of approximately 10 millimeters, 13 millimeters of ridge height. The region of the 5 is edentulous. We've got D3 quality bone, 10 millimeters of width, 12 millimeters of height, and in the region of the 6, we've got two BDRs with periapical infection. So this region will need a significant sinus lifting for implant placement because we have 13 millimeters of ridge width and 4 millimeters of height. So we've got the first molar, the second molar, the first molar, and then we've got another paramolar here in the upper left segment. So we've got two supernumerary teeth in the upper jaw. Moving quickly to the lower right side, we've got a BDR in the lower right 5, as you can see right here. Periapical radiolucency is present, ridge width of 11 millimeters and height of 16 millimeters. When we move on to the lower right 6, we've got a grossly carious tooth, periapical infection. If it is extracted, we've got a ridge width of 12 millimeters and a height of 13 millimeters. The lower right 8 is distoangularly impacted and very intimately in contact with the inferior alveolar nerve. The lower left side, we've got a root canal and a crown. Poor root canal done, we've got a periapical infection with a crack and resorption. So this tooth definitely has a crack and resorption underneath the root canal. And then we've got the lower left wisdom tooth, which has some form of a cystic radiolucency around the crown. So this is something to be kept in mind, and very intimately in contact and distal angular impaction. Here you can see this is the lesion we were talking about. We've got hypercementosis, we've got intimate contact with the inferior alveolar nerve, and we've got a radiolucency around the crown right here. This is the lower left wisdom tooth